I'm Dr. Matt Young. I'm the president of the American Academy of Implant Dentistry. And today we're going to be talking about our annual conference this November 12th to 15th in Phoenix, Arizona. We're going to have a great main podium program, hands-on workshops, camaraderie where you can meet colleagues, and we have the most amount of newly credentialed members ever, so you get to celebrate with that. Today we have a big honor of interviewing Dr. Tarek Assi. He's implant surgeon and focused on full arch implant surgeries and restorations. He has a great practice in Florida, lectures all over the world, and I've had the pleasure of running a hands-on program with him in Pueblo, Mexico. And I'll tell you, this guy delivers the goods, chairside in lectures, and we're very happy to have him on our main podium this year. Welcome, Dr. Tarek.
Thank you, Dr. Young. It's a great honor for me actually to be on this platform here today. It's a true pleasure to meet you in person and see you in action as well. It's just amazing to be part of this great group, great organization. And I'm so honored and grateful for the opportunity to share what we do at the annual meeting at the AAID in Arizona this year.
Well, we're happy to have you on the main podium, and I know it's going to be a great lecture. The title is using digital dentistry for all On-X cases. Can you tell us some things people will learn at the program?
Of course, absolutely. First, I want to confess and make statement that I strongly believe today this is the best era for implant dentistry. We live in the best time. This is the best time to do implant dentistry because the technology that's available to us today and the knowledge that we have. And yes, of course, 5 years ago, 10 years ago, we did great treatment and we delivered absolutely amazing outcomes. But the technology is advancing and it is advancing so fast. I call it almost at the speed of light. So I feel it is our responsibility as clinicians to adapt and stay up to date with the technology. And that's why I take every opportunity when we come to the annual meeting at the AAID, actually to learn. There's a lot of great opportunity, nice breakout sessions, the main podium, and also I take opportunity to share what I have learned and network with my colleague. And the goal by learning is not just to say, well, we know everything. Absolutely not. But it is to stay current with the technology, current with the data, so we can deliver and provide our patients with the best treatment available.
Well, you definitely have put yourself over the years. I know you're a diplomat in the ABOI and a fellow of the American Academy of Implant Dentistry, and the credentials have been very important for you, and also teaching a residency program. So all those things really line up well to stay on the cutting edge, and you are on the cutting edge. So we're very excited about your main podium lecture and be able to hear all about the digital advances and allow us to treat the patients at the highest level.
Yes, absolutely. And I want to also invite all my colleagues who practice implant dentistry, not only to join the AAID, but also to pursue their credentials and achieve associate fellow, and even ABOI diplomat. Because to me, it comes down to two things. First, it's confidence. And also it's validation that you're practicing implant dentistry at the highest standards and the highest level. Now, when we talk about technology, it is amazing. For me, I enjoy technology myself, so I'm always adapting very quickly. But also, I appreciate technology because it allows us to be more efficient. It allows us to simplify the process in some areas. And I'm not going to spill the whole lecture. I'll leave the excitement for the podium. But in anything we do, we should always try to find simplicity. Simplify what's complicated. And I strongly believe digital dentistry, and today we live in digital era, it's here not to replace us, but to empower us. And it is our responsibility to implement this technology to provide better, easier, faster treatment to our patients.
Well, it sounds great. That's going to be on Thursday on the main podium. So everybody will be able to catch that and see your presentation. You are very busy and lecture all over the place and have a lot of great colleagues. Why have you chosen AAID to focus on, and why have you become such a leader in the academy?
Well, to me, first, I'm very passionate about implant dentistry. So from the day I graduated, I decided I'm going to focus my practice, my studies, my publications, and my education on implant dentistry. And that's been the case for the past 18 years. Now, for the past 7 years, when I became ABOI diplomat, that was the day I decided I only want to practice implant dentistry. And I'm very grateful I was able to do so. So on daily basis, what I practice is, of course, implant dentistry and everything associated with that, including site development, bone grafting, soft tissue grafting, to prepare the site and sometimes to deal with revisions and complication cases. We have to be able to handle all that. So over the past 18 years, I always found the AAID as my home. It is my home. I find the support. I find great clinicians, great, brilliant minds and researchers. I always seek knowledge from the AAID, but also being part of that supportive network, really, it complemented my career. And I feel so proud just to be, call myself AAID member, and of course, with all the credentials as well. But to me, I feel it's my home. And I feel I grew up actually in the AAID too, if you want to put it that way.
Well, it sounds great. Working on these cases, and I know that you look at the patient and you take them through different things to make sure they're at the best health possible before placing the implants, and that way we can limit complications down the line.
Absolutely, absolutely. And the AAID also, to expand on that, it's a great platform from many aspects. Of course, education, credentialing, but also recently I joined the Smile Veteran Program, which is so exciting. And the AAID is also help facilitate that, so we can provide free implants, complementary implants to the veterans. And I strongly believe that's the least we can do, all of us as clinicians, as a give back to the community and pay back to those who put their life on the line so we can have our freedom and can have this actually, what we're doing right now.
The Smile Veteran Program is a great program. It changes the lives of our veterans. It's awesome. So, we do reach out to our members, and if they want to become a provider in their area, they can reach out to us and find out how they can help a veteran. And we also have our AAID Foundation, our charitable arm of the American Academy of Implant Dentistry, and this helps to sponsor projects like this and also research to move our industry forward. So AAID Foundation and Smile Veteran Program. Thank you for mentioning those. Those are two great programs that we've really worked hard to develop, and we have a lot of great leaders working with them.
It's a great cause, and I have many of my colleagues actually. They are not AAID members, and when they saw my post about the veteran, and all of them they were texting me, "How do we join this? How do we do this?" Always, I feel good energy and good cause will inspire other people to be part of it as well. So I'm sure many people will join or will have similar ideas to give back.
Well, it sounds great, and just talking to you like this, we learn a lot at the main podium, but we also learn a lot by talking to our colleagues, and that's one of the great things about being in person with you for the hands-on program and being able to see an AAID. Can talk about what you're doing in practice, how you treat patients, and talk about our families and life, and it's really a great thing to be in person.
Absolutely, absolutely.
Yeah. Well, thank you very much, Dr. Tarek Assi. We really look forward to your lecture at the AAID annual meeting. Come to AAID November 12th to 15th, Phoenix, Arizona.
All right. Thank you so much for having me here today. I'm very honored. I'm looking forward to an amazing time and epic event. Epic event.
Awesome.
I see everybody in Arizona at the AID. See you there.
Awesome. Thank you. Have a
Thank
good
you.
day.
Bye.